this is how black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place. And he gladly told me, I know you're a doctor. And he didn't want the black doctor to have no medicine, nothing.
Carla, you'll remember towards the end of last year, Dr. Susan Moore, 52 years old, a physician in Indianapolis, died from COVID. But before dying, she put on Facebook her account of what was happening to her in the hospital. And her account is not uncommon from what we have heard across this country about the United States healthcare system. It's called health inequity. That's the fancy name for saying you don't feel like you are being treated fairly when you go into a hospital or when you go to the doctor. And so today we want to really dive in and talk about health equity, what that means, and how do you protect yourself?
Yes, and healthcare, your health being compromised, actually. And it could be with the doctor's visit. It could be when you are actually a patient in the hospital, but you're already feeling a little funny when you go into the hospital. And a lot of times this has gone on for decades. There have been experiments with Black bodies, especially with African American women. And today, as you said, we are going to look at what's going on with health equity and inequity in the community. We're proud to present today. One of our interns is going to take us through a journey through history, and she is going to tell us about health equity and what has happened to African Americans and other people of color throughout the decades. So from Simmons University, here's Brooklyn Gumby reporting.
We begin our story in 1985 with the Heckler Report on Black and Minority Health. This served as the first gathering of health experts to lead a comprehensive study specifically for minority health. The following year, in 1986, the Office of Minority Health was created within the U.S. Department of Health and Human Services to directly improve the health of racial and ethnic minority groups through health policies and programs. In 1990, we see the passing of the American with Disabilities Act, which prohibits discrimination based on disability, which proves important because the CDC reports 3 in 10 American Indian Alaskan Natives, 1 in 4 Black people, 1 in 6 Pacific Islanders, and 1 in 6 Hispanic people have disabilities nationwide. Then we have the Minority Health and Health Disparities Research and Education Act of 2000 that places importance on research related to minority health and specific medical training. Following that, in 2003, brings the Healthcare Equality and Accountability Act. The aim here is to improve minority health while emphasizing the elimination of racial and ethnic disparities in health and healthcare. In 2008, we see the Medicare Improvements for Patient and Providers Act that checks the balance of Medicare compliance with the Office of Civil Rights guidelines. Lastly, from 2010 to the present day, we see one of the most influential acts passed regarding health equity. The Affordable Care Act, more specifically Section 1557, prohibits discrimination on the basis of race, color, national origin, gender, disability, or age in a number of federally funded programs and agencies.
I want to thank Brooklyn for taking the time to go through the history because, again, it was shocking when people saw this video that Dr. Moore did, but so many of us who have been covering health disparities for years knew that this was not, unfortunately, something new. The question is, how do we end this?
Exactly. And there is a concern anytime you check into the hospital, or whether it's a major or mini or minor procedure. 4 years ago, a gentleman named Charles B. Johnson IV took his wife, Kira, to the hospital to have their second child. And they were excited, and so was his mom, TV Judge Glenda Hatchett. But something went wrong, and Charles says that Kira was in excruciating pain, and no one would listen to her concerns. Again, we're talking about health equity and inequity and your health care being compromised. Kira didn't come back home. And today we want to show you what happened and what's happening to African American women across the country. The incidents are going on at alarming rates, and we're going to point out some of the things that Congress is doing and nonprofits in order to see some changes.
The birth of a baby is one of life's greatest joys, but many times cries from the mother are not being heard.
I went to a different hospital and they found an 11-centimeter abscess on my uterus, and they said that had I not come in, it could have easily been a there's nothing we could do situation.
700 women a year die in our country from pregnancy-related complications, according to the CDC, and that is why they launched the Hear Her campaign. Statistics also show African American women die the most from childbirth. Maternal health equity is a priority for members of Congress, last year passing bipartisan legislation to improve care and to reduce mortality, and in 2021 reintroducing the Black Maternal Omnibus Act, a larger package of legislation tailored to address the existing gaps in maternal health care, with a particular focus on addressing equity and racial health disparities. It is supported by Vice President Kamala Harris.
What we know is that this is an issue that directly impacts Black women, but this should not be only a Black woman's issue. This should be everyone's issue in terms of the priority. And the facts are clear. Black women are 3 to 4 times more likely to die in connection with childbirth than other women. The facts are clear. College-educated Black women are more likely to suffer complications from pregnancy and childbirth than white women who never graduated high school. And these tragedies are occurring to Black women regardless of socioeconomic status, regardless of educational level. The reality is that when a Black woman walks into a health clinic, a hospital, or a doctor's office, she is not taken as seriously when she describes her needs and what she needs in terms of the health and well-being of her baby.
So let's talk about this woman who is Kira Dixon Johnson. We're talking about a woman who was far better than I ever deserved and made me far better than I ever thought I could be. We're talking about a woman that raced cars, who ran marathons, who had her pilot's license. Talking about a woman who spoke 4 languages fluently and who taught me so much, not only about myself, how to be a father, but just about love. We walked into Cedars-Sinai Medical Center with Kira on April 12th of 2016 with a woman that was not just in good health, she was in exceptional health.
Hey, Mommy.
Hey, Daddy.
Hey, Winston.
Hey.
She went in for the procedure. Shortly after that, we were taken to delivery. God blessed us with another substantially, amazingly healthy, beautiful baby boy. Shortly after that, Kira sitting in the bedside, and I began to notice blood in the catheter. I alerted the nurses and the medical staff. They came to her attention. They examined her. They did several things. They ordered a series of tests of blood work. Around 4 o'clock, they ordered the CT scan that was supposed to be ordered stat, and I understood that to mean immediately. I was concerned, but at that time, I understood that there was a plan, and I could live with that. 4 o'clock comes. 5 o'clock comes, still no CT scan. 6 o'clock comes, they perform an ultrasound. They see that her abdomen is filling with fluid. Her blood work comes back. It shows that her blood levels are dropping. She's beginning to lose color. She's shivering uncontrollably. When they examine her, she's sensitive to the touch. So by 5:30, 6 o'clock, there were very clear signs that she was hemorrhaging internally significantly. 7 o'clock comes, still no CT scan. 8 o'clock comes. I'm begging, I'm pleading. My family is advocating for my wife. Still no scan. 9 o'clock comes. They say that they need to do a blood transfusion. And I ask and I'm begging again, do something. Where's this CT scan? I thought it was supposed to be performed stat hours ago. At which point the staff at Cedars-Sinai Medical Center tells me that your wife isn't a priority right now. 10 o'clock comes, still no scan. 11 o'clock comes. it was not until after midnight that they finally took Kira back to the OR. As we left the recovery room and walked down that hall to the OR, and I'm holding Kira's hand and she's telling me, baby, I'm scared. And I'm doing everything in my power to just remain calm and tell her everything's gonna be okay. The doctor says to me, I'm gonna go back into the same incision I made. She'll be back in 15 minutes. And that was the last time I saw my wife alive. When they took her back into the OR, they opened her up and there were 3.5 liters of blood in her abdomen. And she coded immediately. Kira deserved better. My sons deserved better. Women all over this country deserve better.
Charles Johnson has honored his wife's memory by establishing a foundation for Kira for Moms. The group advocates for maternal health equity and supports families that have suffered loss. His testimony before Congress was key to the passing of the Preventing Maternal Deaths Act. It supports states to review every pregnancy-related death and develop recommendations for how to prevent future incidents. He is also working with the March of Dimes, supporting the Blanket Change Project. Stacey Stewart is the president and CEO of the group, and as the first African American to lead the organization, she says that the maternal health crisis has intensified with COVID-19.
So as we see that was a very heartfelt story. And I can't imagine being a spouse and seeing your spouse like that, but it happens all the time. And that's why it's important that we pay attention to some of these laws that's going into place. There are hundreds of them. I was just, Carolyn, shocked. I knew there were a lot because I would see these, okay, this is a resolution, this is an act, this is a bill, but bipartisan. So both sides of the aisle are getting together to work on this. And we hope that we'll be able to tell some other stories and follow some of the legislation, especially the big monomus, as they're calling it, that's going to cover not only research, it's going to cover finding out why are women who have money, they have good jobs, this is happening to across the board. One of the things that I've seen in my research is stress. They believe that has something to do with it. And of course, the disparity of not feeling that this person needs pain medicine, not feeling like, well, some people feeling like, well, you're just asking for this. You may have some type of addiction, or you're just wanting to get this. And it's not always comfortable having a baby, as one lady told me that they had said to her. But we can't, and we're going to talk a little more about what can you do when you are in a situation like this.
Yeah, when we come back, we've got some tips for you. While we wait for legislation in Washington, we want you to know there are some things that you can do to care for your loved one or yourself as you are taking them into a medical facility. And then also we'll let you meet who might be the first person you would contact in a hospital if things aren't going as you believe they should go. So stay with us.
Hi, it's Hannah from Docs on Call with some quick tips on how to take care of your mind and body during your quarantine. First, make sure to maintain a consistent daily routine. This can help you feel a sense of control over your day-to-day life. Secondly, make sure that you're drinking regularly and eating well each day. Thirdly, remember that you're a human being and that it's okay to feel negative emotions, but just make sure that you don't dwell or get stuck in them. Another thing that you can do is limit social media or news intake, because the consistent messages of negative information can put a lot of stress on your mind and body. Lastly, do something small but stimulating for yourself each day. This could be writing in a journal, or meditating, or stretching your body. It's okay to just be still, and you don't have to be productive every day. Just remember to be gracious to yourself and kind to your mind. This has been a PSA from Docs on Call.
Even though there is so much against us,
you will see me choose to protect myself and my community from the coronavirus by wearing a face covering.
Because it's going to take all of us thinking about one another.
And even with my face covered, you will see me.
You will see me as a mother, a wife, a friend.
As an athlete who gave everything to the game I love.
As a father, leading by example.
As a sister.
An entertainer.
As a champion for my people.
You will see me finding a light in a dark time.
To unlock our creativity and push our craft.
You will see me demanding the space to tell the stories that matter.
As a man who knows that tough times don't last, but tough people do.
Join us in wearing a face covering to help stop the spread of the coronavirus.
Because covering your face is one small act of kindness that has the power to bring us together.
Welcome back to the Health Wrap, and we want to talk today to you about equity, health equity. You're investing in your health, and other people are you're partnering with you. And we want to look and talk about, what do you do when something does happen, when you feel like your health care is being compromised? We've talked to an assistant dean of diversity from Vanderbilt University, and also a physician and a professor from Morehouse School of Medicine, and they have some tips for us.
When you go in there, make sure whatever your main point is, that you stick to your one point. I need somebody to check this one problem. And a lot of times we lose the focus, lose the essence of our conversation for many words. Sometimes you have to have less words and more focus.
Try to get the provider to explain to you why they are going down the line of thinking that they are. And then that gives you the opportunity to say, you know what, doctor, that's not really what I'm experiencing. What I'm experiencing is this. Make sure that people verbalize to you that they're hearing you and that they're understanding, or that they're doing their best to understand.
I'm a big advocate about bringing someone who lives in that household with you. Don't go to the doctor alone if you can at all help it. Bring someone with you.
And be an advocate for yourself. When I was talking to Dr. Vinson, she had given me an example of her aunt who needed assistance to the ladies' room just last week, and she was calling for it and no one was answering the call. And she told her, to pick up the phone, call 0, ask for the patient advocate, and someone came in a few seconds. So be your own advocate for yourself.
And I know I'm a journalist, but I keep a record of the provider's actions and decisions. I think sometimes it might make them a little nervous that I have my notes out on my telephone and I'm typing a few things that they're telling me or doing, so that I'm aware and I have a date reference and I know what occurred on that appointment and what we were told. I just think it never hurts to be able to look back, and in many instances, I'm also having to relay the information to other family members. So you do want to make sure that the information is accurate. So a big fan of keeping a record of the provider's actions and their decisions, and understanding, making sure you understand those as well. Understand what your concern is and know how to describe it. I think your expert actually went there, where she suggested to get them to explain and see if they understand it. That's a good one.
Right. Be conscious of your provider's attitude and make sure they aren't dismissive and condescending towards you. And Dr. Vinson also said something about that. She said a lot of this is from the heart. And we're dealing with some people who have never been around people like us. And they're practicing medicine, and they may be good people, but they may do some things that are not good, and sometimes not unknowingly. And that you have to let them know, I don't like the way you're talking to me.
Well, and I have to tell you, let's be clear. The physician works for you, and doctors can be removed from a case. That's not offensive. It just is what it is. Sometimes it's just not a good mix. It's just not a good pairing. And so if you really are having that feeling, I'll never forget one occasion where my mother was in the ER and had been assigned to a cardiologist, and I think we were having some cultural disconnect. He being from the African continent, and me being African American. But at one point, as my father came in, he looked right past me and started talking to my father as I'm asking him some of these questions we're talking about. And he told my father to tell me that he was bringing good news. And when he left, I told my father, you should go tell him this is the last time he's coming back up in this room. But my point is this: you don't have to, swear by a particular doctor if you're feeling like you're not getting the results. That's what they call a second opinion. And you might like the second better than the first. And all my friends who are doctors might be offended, but guess what? That's what it is. You want to make sure you're comfortable with the person who's providing you health care. And I know we had a couple others, right, Carla? We'll go through those right
Yes, and I wanted to add one more point. Dr. Danner mentioned what you were talking about, and he said that sometimes the personalities do not mix, but that doesn't mean that you may need to switch. Then you need to tell them, look, again, you're talking to me a certain way, and I don't like it. And that may be their personality. They can get over it. Or if they don't, then it's time to move on.
But let me tell you a little secret. And I've used this a couple of times. And here's the secret. Good people usually hang out with good people. And so if you get a doctor who's really, really good, the best thing you can do is to call that doctor and say, hey, who do you know who also does cardiology? Or who would you recommend? Or here's a question I often give to them. If you were in the hospital,
absolutely,
your wife or your child were in the hospital right now and you needed a cardiologist, who would you call? And I'm listening very intently on what the answer is. Because again, what you might run into in terms of your care initially in that emergency room might not be a good fit for you and your family. And that's what you really have to be aware of. We talked about knowing the basic understanding of all the diagnoses, the current diagnoses that are being presented. Also, basic understanding of the current prescriptions. I think, who was it? I talked to somebody the other day who told me, oh, they write out, that might've been you, Carlo, very organized. You write out all the prescriptions and everything as you're going into the doctor so you can show them the list of all the things. Look, y'all, here's what I do. I'm getting ready to take my mother and my father to the doctor. I go get a big old Ziploc bag and I throw all the medicines in there. And then when I get to the doctor, I can put them all out on the table and say, this is everything that they're taking. So there's no confusion. A lot of times it's not only what they're taking, but the dosage. And we've had instances where they'll go in and change the dosage. So again, you can write it all out and be very organized, and that's a good thing. Or you can throw it all in a Ziploc bag and make sure you got it with you on that appointment.
And the reason they ask that all the time, because things change. I mean, the last time you were at the doctor could have been last week, but something that they may be wanting to treat you with may conflict with what you're already on. Have an updated emergency contact list. Everybody should have this. Everybody. I in my phone, I even have the, in case of emergency, they call it what, ICE, and you put that in there. Everybody should have an updated emergency contact. And I always put 2 contacts on my information as well.
Some people won't be answering their phones, so you want to have some options for them when they start making those phone calls and need individuals who can make decisions. And that, of course, obviously gets you into some other areas that you and your family can explore, such as what we call the medical power of attorney. It's not on here, but think about that. You know, if something happens to one of your parents and there's an emergency and you're on that list, it'd be nice if you or one of your siblings had a medical power of attorney so that you could make some decisions for them if they're incapacitated. And here's the last one. Look, I love when I see young people going to school to become the physicians of the future. I just want to know, and this happens a lot in teaching hospitals, and you've probably seen it, Carla. They start moving on into the room with the doctor. I need to understand who all these people are. And so I've even done a whole introduce yourself and who are you, so I know who's actually in that room. I don't want to impede education, and that's a call that you have to make as well. Do you want to be at a teaching hospital? But I do want to know who's in the room. It's not acceptable that you just bring a whole bunch of folk in as you're talking and holding a lecture in front of my mother, because it's most important that you're having a conversation with my mother or my father or whichever family member I'm with at that time.
Also, if you are going to be at a teaching hospital, you may want to ask, if you're having surgery, are they going to be assisting, or are they going to be, I mean, it is a teaching hospital, but you need to know what's going on.
Absolutely. And that's what we're here for, to give you information so you know, and then you can ask the questions yourself. We'll be back with more right after this.
Whether it's advice on managing your anxiety or tools to help you stay grounded, Coping-19 provides a range of resources and self-care tips to help you cope with this pandemic. We can help. Find the resources that work best for you at coping-19.org.
We have layers of protection. We have layers of options, and the more that you use, the better protected you are. So it helps a great deal to wash your hands, because that prevents the spread of germs. Helps even more to wear a mask, because that helps us with what we call source control. These are diseases that are spread by respiratory droplets. So if we wear a mask, that prevents the spread of those droplets and prevents infecting other people. In addition to that, if we take advantage of the vaccine, we're building layers of protection. So any one of those alone offers some protection, but when you compile those and use all of the tools at our disposal, including the vaccine in particular, that's one of the most important tools, because the flu vaccine is the tool that we have to protect ourselves every year against getting a disease that can be fatal in some people.
The development and publication of this public service announcement was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents are those of the South Carolina Primary Health Care Association and do not necessarily represent the official views of, nor endorsement by, HRSA, HHS, or the U.S. government. Well, the Vice President of the United States had the opportunity to take her second dose of the vaccine, and she, in fact, has done that. So she's completed the 2 courses that they prescribe in this vaccine that's being offered for the fight against COVID. And so many folks are just now starting to get the vaccine. There's been obviously some issues with the rollout and combating the rollout. You also have people who are still debating on whether or not it should happen. And that really is what we're talking about and looking at in this segment.
So, you know, we're discussing COVID numbers on the rise, and we have other medical professionals that are going to share their experience. They are our emerging doctors, and we want to know what they have to say about the vaccine and why it's important.
My name is student Dr. Corinthia Wilkerson, and I received the COVID-19 vaccine. Like many of you, I had my own apprehensions about the vaccine. However, after listening to the presentations by the researchers, I found my greatest comfort in knowing that it was not a live virus going into my body. After receiving the first dose of the vaccine, I did experience side effects. However, I knew that that was my immune system at work and that the vaccine was doing exactly what it needed to do.
Hello everyone, my name is Remington Richardson, and I am a 4th-year dental student at Meharry Medical College. And the reason that I chose to get the vaccine was because of transparency. All too often in the African American community, especially in relation to medicine, apprehension is at the forefront. And so I wanted to get the vaccine to not only advocate on behalf of my community, but also to be able to educate my community. So when I'm blessed to be in a space like the barbershop and I hear the talks of, is the vaccine safe? What are the side effects? What's the differences in the vaccine? I can then step in and educate and put to ease some of the questions that the community does have. And it makes me proud to then walk out of the barbershop knowing that I have truly made a difference, because the people in the shop can then go and advocate and talk to their friends and family and let them know about the true experiences that they've had from the vaccine and somebody that they know that has gotten the vaccine. And it allows them to be able to inspire those and truly help with the public health. So that is why I got the vaccine. Protect your people.
Hi, my name is Will, and I'm a 2nd-year medical student, and I received the COVID vaccine a couple weeks ago. And some of the reasons that led me to getting the vaccination was a combination of trusting and knowing the science behind the development of the vaccine and knowing that it was safe for everyone regardless of gender or race.
I think you were remember Dr. Marcus Yarbrough, a friend
Yes.
of the show. At the time we met him, he was at Howard, and he was practicing there at the hospital at Howard. He said to me recently he's seen too much pain and fear and death. He's now in Philadelphia, and he said many of his patients, they're Black, Latino, lower income with comorbidities, no insurance. And as we've seen so often, that's like a formula for death, heartbreak, and despair. He decided on his own to conduct a survey of his colleagues and some of the patients that he was treating regarding the vaccine, because there's so much discussion as to what is happening, why people in our community might not be taking it. And here's what he learned.
Between 1932 and 1972, the U.S. government, doctors, and scientists used 600 Black men, most of whom were Alabama sharecroppers, as guinea pigs to record the hideous effects of syphilis. The doctors lied to men and their families for 40 years by telling them they were being treated for bad blood. Instead, they were knowingly injecting these men with a disease. Physicians withheld the penicillin that could have cured them. Some men went blind, others went insane. Hundreds died from complications. But the Tuskegee incident ended 38 years ago, before more than half of the current African Americans were even born. If they heard about it at all, it was probably from the 1997 movie, Mrs. Everett's Boys. Or they attended a historically Black university, because it certainly wasn't anything that they were taught in public school, or even passed on by their families. So skeptical, I decided to conduct a random survey with Black patients and medical colleagues in my hospital. Would they take the vaccine? Most of my fellow clinicians, say 2 or 3, said that they would, and a quarter of them said that they would be doing some watchful waiting. They threw out terms like efficacy, immunochemistry, and pooled analysis data, but none of them mentioned the Tuskegee experiment. A lot of patients said they would take the vaccine, reluctantly, but most said that they would not. Some voiced concerns about a watered-down vaccine. Some said it had been developed too quickly. One said that the government might use the vaccine to kill off Black people, as they did with the AIDS virus. Their reasons reflected a deep distrust of America and its institutions. For them, they represent a dangerous maze populated by bad actors who meant them no good, historically or now. For others, it was a matter of access. As a 27-year-old woman told me, unless a drive-through vaccine site has the ability to allow city buses, then I won't be getting that vaccine. And oh yeah, none of them mentioned the Tuskegee experiment either. Our conversations made me see that this pandemic looks dramatically different through the eyes of those in poor Black and brown families, and how their reality influences how those communities respond to the coronavirus. They were just as concerned, if not more so, about jobs, about rent, about taking care of their sick relatives, about surviving their own ailments, about keeping the heat on in their homes, food in their refrigerator, about police brutality, about crime. They were concerned about incarcerated family members, about as much as they were about the disease. And these weren't new problems. These issues had been part of their everyday existence long before the coronavirus arrived. Too often, our nation attributes their responses to COVID-19 as indifference or willful negligence. What we do not see is that the coronavirus is just another thing added to a long list of issues that plague their lives. Theirs is an ongoing pandemic. So yes, we need to get all of our communities vaccinated, despite their reservations. But if one thing has been exposed by this crisis, it is that Black and brown people are doing an unfair share of the dying and bearing a disproportionate economic burden because of the decades-long pandemic they have been enduring in the shadows. This disease will ultimately pass, but when it does, will we have the courage and the foresight to find a vaccine for what truly plagues them?
So again, we invite you to participate in an interactive discussion with the doctor. Share your views on whether to take the vaccine or not, and whether or not it is being supplied and administered in an equitable fashion. So we appreciate him sharing his opinion with us and giving us some insight in another part of the country on how the process is occurring and what patients and physicians are saying.
And Carolyn, even though we have the vaccine rolling out, we want to still stay masked up.
Absolutely. Absolutely. Yes. And we thank you for being with us. We want to invite you back for our show next month as we look at the first 100 days of this new administration. These are the days that our new president-elect, or he's president now, Biden, intends to do some things in the first 100 days. So be sure to join us and don't miss that.
Well, thank you for joining us, and we will see you later, and stay safe.
Docs on Call is proud to partner with the W.K. Kellogg Foundation, Gwen Ifill College of Media, Arts and Humanities at Simmons University, along with the School of Social Work, the Program in Public Health, and the President's Advisory Council on Diversity, Equality, and Inclusion.